The Food and Drug Administration has approved updated COVID-19 vaccines that could be available by Labor Day. The shots are cleared for adults and children as young as 6 months. It comes on the heels of a summer surge that's killing roughly 600 Americans every week. Here now, Fox 11 medical contributor Dr. Michael Daignault. He's an emergency physician at Providence Little Company of Mary in Torrance. Good to have you. It's been a couple weeks since I've been with you. First question is about the updated COVID-19 vaccine, which was just approved. How soon can we expect it, and who should be getting it? Who do you want to get it?
So it should be available in a couple weeks. The first thing to know that it targets KP2, which is the most prevalent strain right now, the one that's causing the surge of cases that we're seeing this summer.
Is that the flirt variant?
Yes, one of those.
Flirt. Okay.
So compared to last summer, where they manufactured really early, by the time the vaccine rolled out, it wasn't a good match. The virus had already mutated a bunch. This time they decided to wait, and they were able to hit the nail on the head. So I think it's a really good match this year. But what I don't agree with the FDA and the CDC is on their guidance of everybody 6 months or older needing this. Because if you look at the data, people that are 65 and older have a 5 times higher rate of becoming hospitalized than those just under 64. And those over 75 have an 8 times chance higher of dying from COVID than those just under 75. So I wish they had targeted their guidance a little bit better to be more, risk adverse. It's too broad, and I think it was kind of lazy on their part. I expect more from them in that part. And the other thing is, they're recommending this, if it's been 3 months since your last. And I've written about this extensively. The extended interval between doses, or between when you get infected and a dose, has to be 6 months, 8 months. The longer, the better. A lot of people got infected this summer, and I think they probably want to know, did I have COVID or not? A lot of people aren't doing testing, so I think people want to get a PCR test or an antibody test to check whether they had it this summer, because there's a good chance that you did. But specifically for those over 65, I think that's the magic number. If you're over 65, or if you're younger and you have a lot of comorbidity, medical problems, this vaccine booster is what you need. But, for everybody else, I think we should wait.
Okay. What are you seeing in the ER in terms of COVID right now? Yeah,
I think it's affecting those who are older. It's causing altered mental status. It's causing fevers and chills, weakness, fatigue. And it's not requiring a lot of resources to take care of these people in the hospital like back in the day. They're not hypoxic, but they're still taking up hospital bed.
Sure. Okay. Well, we have a little onset demo now. So a lot of people have to use the EpiPen who have severe allergic reactions that could be deadly. Now, this is a needle-free alternative just approved by the FDA. This is called the Neffy. How does this work?
So this is amazing. As you mentioned, we've only had a needle-based epinephrine dosage system, and so that's paramedics or patients having to stab you with a needle when you're having severe allergic reaction or anaphylaxis. And so understandably, there's a lot of needle injuries where they accidentally hit their finger, they don't get it in the right place, or especially kids are scared to have their parents administer epinephrine. So this is a game changer. And so basically how it works is it's a plunger. It comes in a 2-pack, each 2 milligrams each. And what we would recommend is that you pick one nostril, you just push down in the plunger. It's a nasal spray. And you have a second one that you can give 5 minutes later if you're still having symptoms of anaphylaxis. And it's going to be a total game changer. They're pricing it right now. It looks like it's going to be available in about 2 months. Obviously less for those with insurance. I think it's about $200 if you don't have insurance.
Okay.
But it'd be great to see in the hospital as well.
It's amazing that it's taken really this long for an alternative, because the needle has been the only alternative forever, right?
Right. And the thing with epinephrine for severe allergic reaction, I know people don't want to do it, and we always give Benadryl, steroids, and Epi in the ER, but Epi works the fastest. Time and again, I've seen it almost every shift in the ER. When we give epinephrine, the symptoms clear up, within seconds, if not minutes.
Lifesaver right there. It's called the Neffy. If you have severe allergic reactions, look up the Neffy. Reach out to Dr. Michael Daignault on socials. Okay, Dr. D, thank you so much. We appreciate you being with us tonight.